Hello and welcome again to our tutorial on Part A Medicare benefits, also known as hospital insurance. I'm Brian and once again happy to have you here. Please visit our forum where you can post comments, questions, and get answers about Medicare. In this tutorial we're going to talk about the services and costs of Part A hospital insurance. By now everyone should have downloaded your Medicare and You Manual 2016. You see, there are so many services that Part A covers that we cannot go into all of them. We're going to highlight those Part A services which are most used and possibly costly, the ones that you have to be aware of. These slides are downloadable and are located in the medical resource section of our Nebula Insurance website. I'm going to briefly go through each side and I will make comments that I believe you should be aware of. So Part A, what does it cover and what do I pay? Let's say that you decide to stay with Original Medicare and you're going to find later on that you do have a choice of staying with Original Medicare, or you can choose another type of healthcare plans such as Medicare Advantage. But here we have Brian that decided to stay with Original Medicare. The essential coverage of Part A, which is also called hospital insurance, are the costs when Brian gets admitted to the hospital as an inpatient. We also have hospice cares, home health care services, and an inpatient care in a religious non-medical healthcare institution. Medicare pays for some of the costs, and Brian is going to have to pay for some of the costs also in the form of co-payment, co-insurance, and deductible. Co-payments are normally a small amount, co-insurance are larger amounts possibly, and deductible is the cost that you have to pay out of pocket before Medicare pays. Now, as far as costs, the first thing that is going to happen after everything is complete, Brian left the hospital, he gets a bill. If he wants Medicare to pay, then he's going to have to pay the deductible for Part A services, which is for the 2016 year is $1,288. After that, Medicare starts paying the hospital bills according to benefit periods. Now, the simple way to explain what the benefit period is this way. After you pay the deductible for Part A, Medicare will pay for all costs for Part A services for 60 days, which starts the day you were admitted. After the 60 days, you are paying co-payments. And after 150 days, you are paying all the costs. Now let's say that Brian goes into the hospital for 10 days. All he has to pay for Part A services is his deductible. Then he gets discharged on day 10. Now be aware that his benefit period is still running. If Brian goes back to the hospital after 3 days, as long as he doesn't go over the 60 days, he still pays nothing because he's still within his 60-day period. But if Brian comes back to the hospital day 61, a new benefit period begins. A new deductible must be paid. Let's look at some examples. Julie spends 3 days in the hospital. She pays the $1,288, and that's all the cost. She pays nothing else. Hector stays in the hospital for 5 days in December. He came back to the hospital in February and stayed for 3 days. He wasn't out of the hospital for 60 days before he went back, so his 8 days are all in a single benefit period. He pays his deductible once. So he paid $1,288. That's all he pays. Now Margaret stayed in the hospital for 5 days in January. She was readmitted in September and stayed for 65 days. Well, she was out of the hospital more than 60 days. So a new benefit period begins. And if you look at the math, she has to pay $4,186 out of pocket. It can become expensive. Now one looks pretty much a very expensive experience. He actually stayed in the hospital for 185 days. And after all is said is done, this is the itemized bill. Medicare Part A, he paid $1,288 to get admitted. That's his deductible. Then from day 61 to 90, he had to pay $9,660 out of pocket. Days 91 to 150, he had to pay $38,640, and beyond that, another $42,000. Anyway, his total bill was $91,588. And this is what I'm talking about. This can be very expensive for a long stay. And this is just Part A we're talking about. What about Part B? Remember that Part B pays for the doctor's services, which is completely separate. Part A does not pay for doctor services. They only pay for the room, the meals, and some little bit of stuff. Now, in some cases, one must decide during an emergency room visit whether it will be more cost effective to get admitted to the hospital or be treated as an outpatient. It's a very hard call to make. It requires a good consultation with a doctor that's taking care of you, and you must ask a lot of questions, especially about the cost. Okay, so now we're going to talk a little bit about the skilled nursing facility, and this will be the only two services, Part A services, we're going to be talking about. But let's say that Brian, after his admission, the doctor decided, because the doctor has to make a decision, that he should be admitted to a skilled nursing facility. Well, the first 20 days, you don't have to pay anything. But after day 20, from days 21 to 100, he has to make a co-payment, and after 100 days, he's going to pay all the costs. Between these two Part A services, it can be very expensive under original care. As we talked about Part A hospital insurance that they only cover, here's a little list of the services that they cover: semi-private rooms, meals, general nursing, drug as part of your inpatient treatment, and other hospital services and supplies. But the doctor services, x-ray, surgeon fees, anesthesiology fees, you have to pay a co-insurance of 20% of those costs, and it can cost you into the thousands. I did put a few links over there for you to link on. They're not clickable here, but you can always go back to nebulainsurance.com under medical resources section, and you'll see the links there, and you can download it. One fact that I want to make clear is that choosing whether you're going to stay on original Medicare with or switch to another healthcare plan such as Medicare Advantage is a tough decision that requires a well thought out process. As always, I'm here to assist you in that decision, but eventually you will have to make the final decision. All my slides have this contact, Social Security contacts for questions. Please use it. Once again, thank you very much for coming and listening to this tutorial. This concludes the Part A tutorial. If you have any comments, questions, please visit our forum, Nebula Insurance Forum. And once again, thank you. And there's my 800 number. If you need to call me, please do call me. We're going to move on to Part B in your next tutorial. Have a great day. Goodbye.